At 75 and beyond, it's rarely one single illness that leads to death. In most cases, it starts with something small, a mild infection, a slow change in heart function that the body can no longer recover from the way it used to after 75. The human body doesn't suddenly stop working, but its ability to compensate becomes much weaker. A healthy younger body can handle stress, infection or injury and bounce back. At this age, however, the same problems can set off a chain reaction. One issue leads to another, and recovery becomes harder with each step. Understanding these patterns helps explain what actually drives health decline in later life and where prevention can still make a difference. 1. Heart disease. In many people after 75, heart disease develops gradually over years without obvious early warning. The main issue is usually a slow narrowing and stiffening of the arteries, which forces the heart to work harder just to maintain normal circulation. Over time, this can weaken the heart muscle and reduce its pumping efficiency, leading to chronic heart failure, sudden cardiac events. What makes it especially risky at this age that symptoms are often subtle, such as unusual fatigue, mild breathlessness during light activity, or reduced ability to do daily tasks, rather than dramatic chest pain. Because of this, it can progress quietly until it becomes severe. Controlling blood pressure, cholesterol, blood sugar, and maintaining regular medical monitoring are key factors in reducing long-term risk to stroke. Stroke occurs when blood flow to the brain is interrupted, either by a blockage or a rupture of a blood vessel. After 75, the risk increases due to long-term conditions, such as hypertension, diabetes, and irregular heart rhythms like atrial fibrillation. When it happens, it can cause sudden weakness, speech difficulty, or loss of coordination. Even when survival is possible, recovery is often more difficult because the brain's ability to adapt and repair is reduced. Early recognition of symptoms such as facial drooping, arm weakness, or slurred speech is critical in limiting long-term damage to cancer. Cancer risk increases with age because cells accumulate genetic damage over time. After 75, the immune system is also less effective at identifying and controlling abnormal cell growth. Common types include lung, colorectal, and prostate or breast cancer. Depending on sex in many cases, treatment decisions become more complex because the body may not tolerate aggressive therapy. As well as younger patients, early detection remains one of the most important factors in improving outcomes. For respiratory infections, pneumonia and flu complications, respiratory infections become significantly more dangerous after 75 because lung function and immune response both decline with age. Conditions like pneumonia or influenza can quickly progress to breathing difficulties, and oxygen shortage hospitalization is common, especially when combined with existing heart or lung disease. What may start as a mild infection can escalate faster than expected, making vaccination and early treatment important. Preventive measures. 5. Falls and related complications. Falls are a major, indirect cause of death in older adults. While the fall itself may not be fatal, the resulting injuries such as fractures or head trauma often lead to reduced mobility. This loss of movement can trigger complications, including infections, blood clots, and muscle wasting. Over time, this creates a cycle of decline that becomes difficult to reverse. Prevention usually focuses on balance training, safe home environments, and regular vision and medication checks. 6. Dementia-related complications. Dementia does not usually cause death directly, but it significantly increases risk through secondary complications. As cognitive function declines, individuals may forget basic needs such as eating, drinking, or taking medication correctly. This can lead to malnutrition, dehydration, infections, and accidental injuries. In advanced stages, overall physical health often deteriorates, making the body more vulnerable to other illnesses. 7. Chronic obstructive pulmonary disease, COPD. COPD is a long-term condition that causes progressive breathing difficulty, often linked to smoking history or long-term exposure to air pollutants. After 75, reduced lung capacity makes flare UPS more severe and harder to recover from. These episodes can lower oxygen levels and place additional strain on the heart. Management focuses on preventing exacerbations and maintaining stable respiratory function. 8. Kidney disease. Chronic kidney disease develops when the kidneys gradually lose their ability to filter waste and excess fluids from the body. After 75, this decline becomes more impactful because it can affect heart function, blood pressure, and overall metabolism. In advanced stages, toxin buildup and fluid imbalance can become serious, especially when combined with other chronic conditions. Regular monitoring helps slow progression and reduce complications. 9. Diabetes complications. Diabetes becomes harder to manage after 75 Due to reduced physiological stability, both high and low blood sugar levels can lead to serious issues, such as confusion, weakness, and increased infection risk over time. Diabetes also damages blood vessels, nerves, kidneys, and the heart, often contributing indirectly to other major health conditions. Sepsis. Sepsis is a life-threatening response to infection, where the body's immune system causes widespread inflammation and organ dysfunction. In older adults, infections from the lungs, urinary tract, or skin can escalate quickly. Early signs may be subtle, such as confusion or weakness, which can delay treatment. Rapid medical intervention is critical to improve survival outcome. 11 medication side effects and interaction. Older adults often take multiple medications, increasing the risk of drug interactions and side effects. Changes in metabolism and organ function make the body more sensitive, which can lead to dizziness, leading risk, kidney strain, or confusion. These effects may also indirectly increase the risk of falls or hospitalization. Regular medication review is important to reduce unnecessary risks. 12. Dehydration and malnutrition. Reduced thirst sensation, appetite changes, or difficulty preparing meals can lead to dehydration and malnutrition. This weakens immunity, muscle strength, and cognitive function. Mild dehydration can cause dizziness and confusion, increasing the risk of falls and illness. Maintaining proper fluid and nutrient intake is essential for stability. 13. Hip fractures and bone weakness. Bone density decreases with age, making fractures more likely even from minor falls. Hip fracture is especially serious because it often requires surgery and long recovery periods. During recovery, immobility can lead to complications as infections or blood clots. This makes fractures a significant contributor to overall health decline. In older adults, 14. Frailty and overall physical decline. Frailty refers to a general state of reduced strength, energy, and physiological reserve. It is not a single disease, but a combination of muscle loss, weight loss, and decreased resilience. This condition increases vulnerability to nearly all other illnesses listed above. When the body's reserve is low, even minor health stresses can become life-threatening. In reality, most deaths after 75 are not caused by a single condition alone, but by the interaction of multiple health issues that gradually reduce the body's ability to recover. Heart health, brain function, immunity, nutrition, and mobility all play a role in overall survival. When one system weakens, it often affects others, creating a chain reaction over time, while aging itself cannot be stopped. Many of these risks can be reduced or managed through regular medical care, early detection, proper medication use, and consistent attention to daily health habits.